I'm here talking with Dr. Thomas Kotoske at Body by Kotoske, and this one is my favorite. I had this done, but it's very secretive. A lot of people don't admit to having this done, and we're talking about the quick lift. It's probably your most popular procedure, would you say?
It is, yes. We have people that come from all over to get this procedure done. In fact, 30% of my practice actually comes from out of state, out of the country. We do a lot of facial reconstruction, meaning facelifting, and this is one of the primary procedures that I do to enhance or rejuvenate the face.
Now, we're talking the quick lift. What is the difference between a quick lift and a traditional facelift?
Great question. The dissection is basically the same, meaning we do the same lifting of the skin and so forth. It's where we put our deep retention stitches to raise the muscle up. It's more of a vertical movement in an upward fashion that takes this cheek pad back up to where it needs to be. It restores the jawline and the neck. So I'm doing a face and neck lift when I do this procedure. Traditional lifting has a little bit more of a horizontal pull. So sometimes you'll still see people that have a different inflection or flow to the eyes. The mouth becomes lengthened, therefore fillers are utilized to kind of combat that. That's kind of an antiquated technique, and you'll see people that all walk out with that same animation. I don't do that. I do a very natural look. These procedures, by virtue of where we put our stitchers, they allow you to heal very quickly, meaning people are back to their normal work or environment, doing the things they do within a week to 2 weeks. As far as the actual incision, it's hidden. They heal absolutely beautifully, and it's natural. People have a very natural look. People look at you once you've had one of these done and say, God, you look great. What have you been doing? You don't look over plasticized. It has long-term results. It lasts as long as anything on the market. So I've been a fan of this. I've been doing it for 20 years. If you look at most residency training programs, they're all moving towards a vertical plane lift at this point. So we've been ahead of that curve for a very long time.
I have to say, I loved mine. Thank you so much.
You are welcome.
No, but I can't.
And you do look beautiful.
You can't see anything in my ears or anywhere, and it was the recovery. Let's talk about that. It was really simple for me. It was like quick.
That's fantastic. And typically, you do have to allow your areas to heal where we do our suturing and so forth. But at the end of the day, you're feeling pretty good very quickly. Yeah. Pain-wise, it's probably a 1 to 2 on a scale of 10, 10 being your worst pain. Most patients aren't taking much pain medication after the first 48 hours.
Yeah,
Tylenol, for that matter.
Tylenol, that was it.
Yeah.
It was great. And now, what age ranges are we talking about for the quick lift?
I see people that can have a lift in their 40s, mid to latter 40s, that start to show the signs of aging. Sometimes they're just showing it, we do the procedure, and they stay static for the next 10 to 12 years. You don't see the changes where everything just sort of drops. So those are great patients to do the procedure on, but we'll do this procedure all the way up into the 70s. Of course, we do preoperative clearance. We're very picky on who we do surgery on, but that's for the safety of the patient. This is a practice that's my utmost thing that I look at. I want to make sure that people are well evaluated and well taken care of.
Well, I just love it. Thank you, Dr. Kotoske.
You are welcome.
I highly recommend the quick lift.